Hello everyone, let's start it with the definition of symptothermal method. The name symptothermal comes from the body cues, symptoms, and the woman's temperature, thermal or thermometer. The method based on the woman's internal body temperature upon awakening in the morning to determine fertility or infertility to avoid unexpected pregnancy. The method has two different parts. The first one is about thermal. Woman's body temperature is lower during the first part of the menstrual cycle. Now it's around 97.2 to 97.4 degrees. It usually rises slightly after ovulation when an egg is released, and now the temperature will be above 98 degrees. When the temperature stays elevated for at least 3 days, a woman may assume she has already ovulated. Intercourse for the rest of the cycle will not result in pregnancy, and the temperature will fall just before her next period. To determine the infertile time before ovulation, a woman needs to look at her pattern of previous cycles. Her last safe day is 1 week before the earliest recorded day of temperature rise, or 5 days after the first day of her period. And the second part of our method is about symptoms. In addition to basal temperatures, the infertile time before ovulation can be more accurately predicted by body symptoms, such as redness or mucus level. A woman first has a few days of menstrual bleeding, followed by a few dry days when the vagina seems quite dry and no mucus is present. Closer to the time of ovulation, she starts to have more wetness. The last day of the peak wetness is right before ovulation. Now we'll learn how to use the method. Use a basal thermometer to take woman's body temperature every morning as soon as waking. Do it before getting out of bed, talking, eating, drinking, having sex, or smoke. Keep the thermometer in place for 5 full minutes. Read it to within 1/10 of a degree. The changes will be in fractions of a degree, from 1/10 to 1/2 a degree. Therefore, we should choose a large-scale thermometer that only registers 96 to 100 degrees. It will be much easier to read. Some basal thermometers are to be used to be in mouth, and some others are to be used in rectum. Rectal thermometers are generally more reliable, but whatever we choose, be sure to take temperature the same way every day. And here is an example of temperature chart. Look at this table. This chart, we can see the change of temperature over a menstrual cycle. The failure rate of this method is slightly high. Among experienced users, the symptothermal method has an overall annual failure rate of 13 to 20%. That means each year, about 1 in 7 users of this method experience surprise pregnancy. The method is completely ineffective if used incorrectly, but for perfect users, the method has a failure rate of only 2 to 3%. The method has some advantages, such as quick tell when ovulation has happened, inexpensive compared to other methods, may be effective when used perfectly, no serious side effects, for no hormones, medical or surgical procedures involved, increased knowledge of reproductive philosophy, enhanced self-reliance, and the method can be used to immediately transfer from pregnancy avoidance to pregnancy planning. The method also has some disadvantages. It requires careful and detailed record every day, unforgiving of imperfect use. Irregular menstrual cycle makes it more difficult. A lack of sleep or upset can cause a woman's temperature to vary. Either one of ovaries may decide to emit an egg at an irregular interval without any symptoms. The method is high risk in terms of STIs. By choosing this method, couples also choose shared sexual activities. But according to Hart, most shared sexual activities carry some level of risk. It's easy to obtain a basal thermometer. It's available without a prescription at pharmacies or online, and the price will vary around $9 to $20, depending on brand names and location. Because the failure rate of the method is high if using incorrectly, while perfect use is rare. So my recommendation is combining this method with others, such as cervical mucus, condom, or any other one, will lead to more accurate results. In the same manner, couples also use this method if they want to be pregnant. Finally is the list of references. Thank you for watching and have a nice day.